Hi students, today one more important practical aspect question, estimation of creatinine, right? For you already I told you, for your university examinations, 4 important molecules or parameters for your university examination. One is glucose, another one is urea, next is creatinine, finally protein. Definitely these 4 will come for your university practical examination. So you should know A to Z about the practical examination of all the 4 compounds, right? Already we have uploaded glucose and protein estimation. At your free time, you please go through. Very useful for your university examination. Today the topic is estimation of creatinine. This is part 1. Next is part 2. It is actually a simple estimation, simple procedure, but there are a lot of questions are there. Clinical importance are there. Normal values are there. All are very, very important. Right? Then only you will get good marks for this creatinine estimation. Okay. So first I have given some questions, repeatedly asking question about the introduction of creatinine. Right? What is creatinine? What is creatine? That is creatine. Creatine is different. Creatinine, NINE is different. Where it is derived from? Actually, 3 amino acids involved in the synthesis of creatinine. Storage form. Where it will get stored? Usually muscle. Storage form. What are all the organs involved in the synthesis of this creatinine? And then what is the excretory form? Obviously, creatinine, which will be excreted by kidneys. Then CCR, creatine clearance. First you have to measure creatine, blood value and urine value. Then you have to measure the creatinine clearance, because that is very, very important for the measurement of glomerular filtration rate. Glomerular filtration rate, which is one of the important renal function test, right? So next one is, what is the normal level of serum creatinine as well as urinary creatinine? Then normal level of creatinine clearance value. This is entirely different. Creatine value is in blood, creatine value is in urine. Here you are using one formula, that is UV bar P, and then find out the creatinine clearance value. So both are totally different. This is creatine clearance normal level. Second section is routine practical exam related questions. What is the name of the method? For all estimation, you should know the method. In that also, you should mention the currently using method and previously, that is old, outdated method, older methods. Why it is outdated? Why you are using nowadays this technique? Like that, the examiner will ask questions. You have to be ready for the answers. Next one is as usual, principle. In principle, if there is a reaction, means you have to mention the reaction. Next one is reagents. Very, very, very important for this creatinine estimation, because you are having 6 reagents for this estimation of creatine. One is picric acid, second one is sodium hydroxide, third is sulfuric acid, fourth one is sodium tungstate. Right? The last 2 is actually working standard and stock standard. This is actually routine for all your 4 estimation. What is a working standard? What is a stock standard? Stock standard means they have prepared for 100 ml. From the 100 ml, you are taking 10 ml and then add water for 90 ml, make up to again 100 ml. From this working standard only, you are going to do the performance, that is estimation. That is why stock solution, then working standard solution. So these are all the reagents for your estimation of creatinine. Second one is procedure. You all know the procedure. First we have to take 3 test tubes and mark it as a B, S, T, that is B means blank, S means standard, T means test, and add the reagents according to the tabular column. Different colleges giving different measurements. That is why I am not mentioning this. Tabular column, blank, standard, test. Okay. After this tabular column, you have to wait for 10 minutes. That is incubation period. 10 to 15 minutes. Then go for the colorimetric estimation. That is taking OD at 520 nanometer. All points are very important. OD means 520 nanometer. What is the waiting time for this creatinine estimation? 10 to 15 minutes. Box consists of blank, standard, test. Blank means what? Test means what? Standard means what? Standard means unknown concentration. Test means unknown concentration, that is patient sample. You are going to identify how much is present in the blood sample. Blank means distilled water, but no reagent or test sample, right? So next one is you have to apply the formula. You know the formula already. You have to apply the formula, then go for the calculation. Finally, you will come to the conclusion. That is your creatine, patient's creatine value is some X. For example, 1.2 milligram per deciliter, or for example 3.6 milligram per deciliter. That is about result. With the result, you are going to interpretation of the results. That is very important. Interpretation means nothing but first you should tell the normal value, then what are all the high value conditions, what are all the low value conditions. That is enough for first MBBS. Here, increased creatine level seen in high protein diet. If you are taking high protein means the creatine level also will be increasingly synthesized. Then CKD and AK, kidney diseases, chronic kidney disease or acute kidney injury will always having high level of creatinine in serum. Third one is severe dehydration and commonly muscular diseases or muscular dystrophies. So these are all the causes for increased creatinine level. Whereas decreased creatinine means the only condition is next step is decreased GFR, that leads to decreased creatinine clearance, and finally GFR will be decreased. So creatinine clearance or creatinine decreased means GFR will be automatically decreased. So this is the first basic part of creatinine estimation. Don't forget these three words. Creatinine clearance denotes GFR. Decreased CCR, creatinine clearance means decreased GFR. Decreased GFR means one of the important renal function tests that indicates glomerulopathy. Grade 1, grade 2, grade 3 like that. Less than 50, less than 150, less than 550 like that. Protein estimation in glomerular filtration rate. So this is why I am giving separately is creatinine clearance decreased means GFR decreased. GFR decreased means renal function test automatically decrease and patient will go for glomerulonephritis or glomerulopathies. Bye. Right, coming to the part 2, that is estimation of creatinine. We are going to see the answers for the part 1. Right, before going to the answer part, you should know about the metabolic pathway of creatinine. Right? So the first compound, that is amino acid, is arginine. Important amino acid, arginine. This arginine combines with the glycine, produces ornithine and guanidoacetate. This is the first step for your estimation of serum creatinine. The concept is you should know the pathway of creatinine synthesis. The first step is arginine is converted into guanidoacetate with the help of glycine, which produces ornithine. The enzyme name is amidotransferase. Some book says arginine glycine amidotransferase. It happens in kidney. Second one is this guanidinoacetate converted into creatine. First one is creatine, then they will be converted into creatine phosphate. Here the enzyme is methyl transferase. Methyl transferase. That means the reaction utilizes one methyl molecule from SAM. What is the donor of methyl molecule? S-adenosyl methionine, SAM, that is from methionine metabolism. This SAM usually converted into SAH, S-adenosyl homocysteine. Here we are replacing one ATP, that is why creatine phosphate is synthesized. This is the second reaction which occurs in liver. Third reaction is spontaneous. Ne means non-enzymatic reaction. That is, creatine phosphate is automatically converted into creatinine. There is no enzyme involvement. Non-enzymatic spontaneous conversion leads to creatinine, which will be excreted by kidneys. This is the normal metabolic pathway of creatine. This creatine phosphate clinical importance is, this is the storage form of creatine. This is the excretory form of creatinine. Creatinine is the excretory form of creatine. So, like that, first you have to draw the diagram for your creatinine estimation. Now, what is creatinine? It is a breakdown product produced by muscle metabolism. Some books says waste product from protein nitrogenous compounds. Here simply they are giving breakdown product is creatine, which is produced by muscle metabolism, right? Okay, we have three sites of production, three amino acids for the synthesis. Sites of production, kidney, liver, muscle, and formed by amino acids, assistant general manager AGM. So arginine, glycine, methionine. Three amino acids only produces creatinine. Next, normal values. You all know very well about the normal values. Serum creatinine 0.6 to 1.2 milligram per deciliter. Urinary creatinine value is 1.5 to 2.5 gram per day. Very carefully you have to mention the units, gram per day, or some book says per 24 hours. Okay. Next, creatine clearance normal value. This is also very, very important. That is, male 95 to 140, females 85 to 120. So these are all the normal values. Again I am telling, don't forget to mention about the three normal values. Serum creatinine, urinary creatinine, creatinine clearance. All the three are important for your estimation of creatinine. Next one is, what is the name of the method? For any procedure, for any estimation, first you have to tell the name of the method. In that, what we are currently using, what are all the previous one, like that. If the answer is there means you have to mention. Here, Jaffes colorimetric method is the currently using method for the estimation of creatinine. Other methods are Lloyd's reagent method, another one is high performance liquid chromatography. Right? Next, sometimes what happens is, congestive cardiac failure and obstruction in the urinary tract also increases the creatinine value. This is very, very MCQ point. That is why I am giving separately. Congestive cardiac failure, obstruction in the urinary tract also increases the serum creatinine level. Okay. Then creatine clearance formula, I think you all know about the formula, UV bar P. U multiplication V bar P. So what do you mean by U? What do you mean by V? What do you mean by P? And finally, how you are coming to the calculation results like that, you have to explain for the estimation. And the last one is why creatinine clearance is good for the renal function test. How this creatinine differs from urea and inulin. What are all the advantages for creatinine clearance? What are all the specific characters for creatine? Like, for example, it will not affected by exogenous products. It will not affected by some drugs. Like that, exercise, sex and race, everything will not affect in the creatinine. That is why creatinine will select for the clearance value to measure the renal function test. Right? So part 1, part 2 of creatine estimation of creatine is very important for your university examination. Okay.